Hi everyone, and welcome to the Carefeed Channel. I'm John Vander Meer, and I'm pleased to be joined by Doug Farmer, CEO of the Colorado Healthcare Association. Doug, it's great to visit with you.
Yeah, good to see you, John.
Thanks so much for taking a few minutes to talk with me about here during the summer of 2024 about some issues that are facing the skilled nursing and assisted living provider community in Colorado and around the country. The first question I have for you is, as the state exec for Colorado, what are some of the key challenges that you're facing in your state?
Yeah, I think the number one challenge is workforce. And I don't think that's unique to Colorado. I think the whole country is experiencing a workforce crisis right now. What we see in our on the skilled side of the house is we have sort of stopped growing our occupancy at about 7% below where we historically have been.
Sure.
And so you're talking about a couple $100 million worth of revenue that's gone missing from our system. We've seen buildings close. We now have people that are on waiting lists seeking access to the care that they need, and they can't get it because we can't find the staff to fill the slots. And so, a lot of folks have looked at their model and said, okay, look, we have a wing. We've got 10 beds that are empty right now. But when they try to fill them, using temporary staff to do that means that it's just not financially feasible. And so workforce, trying to find some kind of pipeline for the workforce challenge is our biggest need right now.
Yeah, no, I can imagine that. So as you face the workforce challenges and addressing those from a legislative and advocacy perspective, where are you in your association's legislative advocacy cycle, and what can providers do in your state to help advance the association's goals?
Yeah, we've teamed up with a couple of other associations in Colorado and worked really well together, trying to let lawmakers understand that this is not a hospital problem or a nursing home problem. This is a healthcare problem across the entire state.
Sure.
And so our legislative session runs from January to May every year, and what providers can be doing in Colorado right now is reaching out to their lawmakers, helping them to understand what's going on day to day at the building level and what that means for residents and what that means for the community.
Right.
I think lawmakers have to know a little bit about a lot. And so if we can get them in to our care centers and let them see what's going on, then I think they can come back into the Capitol building in January and maybe help make some decisions that will get us where we need to be in the long run.
Do you have any specific regulatory issues that you're facing that you get frequent calls from members about, or that you want to try and address?
Yeah, there's always the issue of consistency of the regulatory process itself, and how two buildings that are a mile apart from each other can be doing relatively the same thing and get completely different survey outcomes. Mm-hmm. So we're trying to work on regulatory consistency. We're also just trying to work on education between survey teams and providers, and getting back to a point where we see each other as partners in a process. Obviously, they have a responsibility, to make sure that the safety and security of residents is what it's supposed to be. But I also think it's valuable not only for our providers, but for our residents when surveyors can come in and actually understand the work that's being done firsthand, not just from the checklist of things they need to look after. When it comes to regulatory issues, most of the issues we face are at a federal level, as you know, and so trying to work with AHCA to get at some of those kind of high pain point regulatory issues. And then in Colorado, we had a brand new regulatory scheme put into place for AL just the year before COVID began. And so as we hit COVID, that went out the window, and the surveyors sort of turned into infection control surveyors. Mm-hmm. They weren't looking at AL regulatory issues. And so having started a brand new regulatory scheme in that way, and under those circumstances, we're now in a position to try and, I guess, re-educate our department on how we think assisted living regulation ought to be working and consistent with the way that those regs were put together. It was done in very much a team format, right? Providers came to the table, state came to the table. We came up with a format that we think would work well for everyone, most importantly, the residents. But we've gotten away from that as a result of COVID. And so our work is really in trying to pull back to regular standard survey processes.
Makes sense.
Yeah.
How do you communicate that message? How do you get the idea to surveyors relative to that? What are your strategies to do that?
Yeah, so I think it starts at the top. It's conversations between myself and the leadership at the department, and they're receptive to that. I think we're fortunate to have people that care. in our state. And so it's that, and then trying to work in roundtable fashion. In the past, on the SNF side of things, we would sit down regionally and bring surveyors and NHAs to the table and just have conversations. And we'd like to get to that same place with assisted living providers.
Sure, that makes perfect sense. And what are your members looking for your association's help with? What do you end up getting a lot of calls about?
Oh, they're all across the board. You know, on the SNF side, there's a lot of movement in ownership. And so transitions of ownership and transitions of operator are consistent. And so there's a lot of questions about how does our regulatory system work? How do we make the most of the financial reimbursement structure? We also, obviously, we do a lot with the regulatory side. Whenever somebody has a survey, they're on the phone with us asking, boy, this really doesn't seem like something I should be getting excited for. Why am I? So it's assistance with how to have those conversations with regulators, and also then what steps to take after a survey, right? Whether it be getting their plan of correction straight or taking things to the next level through the IDR process, or maybe legal matters depending on the depth. But it's across the board. I mean, there's no one thing that seems to hit most.
Carefeed is proud to be a business partner of the Colorado Healthcare Association. And we're glad to have the opportunity to visit with you a little bit about the challenges and opportunities that are facing Colorado under your leadership of the association.
We appreciate your support. Thanks for the time.
Yeah, no question. I've been visiting with Doug Farmer, the CEO of the Colorado Healthcare Association, on the Carefeed Channel. Be sure to visit carefeed.com to see how a resident journey platform of Carefeed makes the lives of providers easier while enhancing connections between staff, residents, and their families. Click the Schedule Demo button to book a time to see how Carefeed's all-in-one platform can save you time and money while improving resident and employee satisfaction. Don't forget to hit the like and share button on your social media dial and follow Carefeed on LinkedIn, Facebook, and YouTube. Thanks so much for watching.